Javier spent a career fighting to expand access to health care, reducing racial health disparities, protecting the Affordable Care Act, and take on powerful special interests to prey on, profit off of people's health, from opioid manufacturers to big tobacco. During this pandemic, he'll protect the safety of the frontline healthcare workers, rooted out the fraud from the bad actors who take advantage of people. And he stood up for homeowners trying to pay their mortgages during this devastating economic crisis. There are things he's already fought for and accomplished in many cases. And as secretary, HHS secretary, he will skillfully oversee the CDC and the FDA, Medicare and Medicaid. No matter what happens in the Supreme Court, he'll lead our efforts to build on the Affordable Care Act. He'll work to dramatically expand coverage and take bold steps to lower health care and prescription drug costs. Javier is a key leader who lead a key agency charged with protecting the health and wellness of the American people. He's also the first Latino leading HHS, the son of a working class immigrant family that came from Mexico, a true public servant who's dedicated his career in the service of the people and the service of this country that we all love. To serve as coordinator of the COVID-19 response team, I'm turning a world-class manager and leader. I've known Jeff for a long time, from the first and last days of the Obama and Biden White House, and throughout the campaign and now the transition. There's no one else that you'd want to help manage some of the most consequential and complex priorities of a country. Director of National Economic Council for President Obama, Acting Director for the Office of Management and Budget. Was there during the Great Recession as we went from crisis to recovery to resurgence in 8 years. He was there to lead the team and help implement the Affordable Care Act and get healthcare.gov up and working at a critical moment. That was a monumental feat that required vision, patience, experience, fortitude, and real expertise. Well respected across the aisle and around the country, from business to labor leaders to entrepreneurs to educators. Chairman of the board of the Children's National Medical Center, one of the world's top children's hospitals. Jeff knows how to build and lead a team, how to identify and solve problems, and how to fully mobilize the federal government on behalf of the health, safety, and prosperity of the American people. Jeff Zients, thank you for being willing to do this again. The Surgeon General of the United States, I nominate a man who could do any of these jobs, I think, but Dr. Vivek Murthy. He's worked with me for a long time. He's a renowned physician and research scientist, a trusted national leader on health care, and for me, a trusted advisor during the campaign and transition. This will be the second time serving as America's doctor, having served in this role under President Obama. During his tenure, he took on some of the most pressing public health issues we face. Excuse me, from the opioid crisis to threats to America's mental health. I've asked Dr. Murthy to serve again as Surgeon General, but with expanded responsibilities. He will be a key public voice on the COVID response to restore public trust and faith in science and medicine. One of the reasons, Doc, I ask you to do this, when you speak, people listen. They trust you. You have a way of communicating. They can just see it in your eyes. I mean it sincerely. It's a really, really important thing to be communicated now when people are in so much doubt. But it'll also be a key advisor to me and help lead all government approach to broader public health issues. We've talked a lot about the need to vastly increase the focus on mental health in the country, addiction and substance use disorders, social and environmental detriments to health, and much more. So I'm really looking forward, and thank you for doing this. Above all, I believe as well as any person I've ever worked with, Vivek can help restore faith in this country as a place of possibilities. The son of Indian immigrants who raised their children to always believe in the promise of America. Dr. Murthy will be one of my most trusted public health and medical advisors, and I'm grateful, and I mean it sincerely, Vivek, I'm grateful for your willingness to continue to stay in public service. And for Director of the Center for Disease Control, the CDC, and Prevention, I might add, I appoint Rochelle Walensky. She's chief of infectious disease at one of the country's most preeminent hospitals, Massachusetts General in Boston, a distinguished professor at Harvard Medical School, and a world-class physician, one of the nation's foremost experts on testing, treatment, and eradication of viruses. She has served on the front lines on the COVID crisis. She's conducted groundbreaking research on vaccine delivery, including how to reach underserved communities that are too often hit first, hardest, and treated last. Dr. Walensky's work was instrumental in helping the world mitigate the public health crisis of HIV/AIDS. It inspired her as a young doctor to pursue her pioneering research in virus containment. Now, she will bring her expertise to bear against COVID-19. She's uniquely qualified to restore morale and public trust. She'll marshal our finest scientists and public health experts at CDC to turn the tide on this urgent crisis we're facing today. Because of the pandemic's disproportionate impact on communities of color, I concluded that we needed a COVID-19 equity task force. To chair it, I appoint Dr. Marcela Nunez-Smith, one of the country's foremost experts on healthcare disparities, Associate Professor of Medicine and Public Health and Management at Yale School of Medicine, Founding Director of Yale's Equity Research and Innovation Center, and co-chair of my COVID-19 Transition Advisory Board. Dr. Nunez-Smith will lead our efforts to provide care to the communities most in need and most affected by the pandemic and often overlooked. She'll ensure that fairness and equity are at the center of every part of our response. This is a central front in our fight against this pandemic, and I'm grateful Dr. Nunez-Smith will lead this charge. And finally, as both head of my National Institute of Allergy and Infectious Disease and my chief medical advisor on COVID-19, I'm pleased to say that Dr. Tony Fauci will be a member of my COVID team. By now, Dr. Fauci needs no introduction, but he'll have my gratitude when I'm president, the 7th president he will have served. We know each other, and we've known each other for a long time. And I'm so grateful when I called him almost before I asked, he said yes. I've seen him take on HIV/AIDS, H1N1, Ebola, Zika, COVID-19, and every infectious disease in between over his nearly 40 years of service to our country. Dr. Fauci is trusted, a truth teller, a patriot. Like every good doctor, he'll tell me what I need to know, not what I want to know. What I need to know, not what I want to know. This is my core COVID healthcare team. Before January 20th, we'll be adding more leaders to oversee vaccine distribution, the supply chain, testing, and other key functions. To each of you on this team, you have my gratitude, and I mean that. You have my gratitude for answering the call to serve. And to your families, I know many of you are making real sacrifices to do this. Thank you. And to your families, I say thank you directly. We couldn't do this without them or without you, the families, supporting this. And to the American people, I know we've all had a lot of sleepless nights this year. So many of you staring at the ceiling tonight worrying, my God, what happens? What happens if it strikes my family? What happens if I lose my insurance? What happens? Am I going to be okay? Is my family going to be okay? All I can tell you is the truth. We're in a very dark winter. Things may well get worse before they get better. A vaccine may soon be available. We need to level with one another. It'll take longer than we would like to distribute it to all corners of the country. depending on how it gets started off between now and the time I'm sworn in. We'll need to persuade enough Americans to take the vaccine. Many of them have become very cynical about its usefulness. It's daunting, but I promise you that we'll make progress starting on day one. But we didn't get into this mess quickly. It's going to take time to fix, but we can do this. That's the truth. And telling you the truth is what this team, Vice President-elect Harris and I will always do. Give it to you straight from the shoulder, as Roosevelt used to say. This is the toughest challenge America's ever faced, one of the toughest. But we know that we can overcome and heal together as one nation. To all of you on the front lines, the healthcare professionals, first responders, grocery store workers, delivery truck drivers, educators, parents, our children, I say thank you. But we can do this. We can do this. I want to thank you for everything you've done to get us through this crisis so far. And we're never going to give up on you, I promise you. And we'll never give up on our country. We can do this. There's nothing we've ever failed to do when we've decided to do together. That's America. To all those who have lost in this pandemic, all those who are sick and suffering, our hearts go out to you. Many of us know what it's like. May God bless you all, and may God protect our troops. Thank you for listening. Now I'd like to turn it over to the team, starting with our next Secretary of Health and Human Service, Javier Becerra. Javier, thank you for being willing to take on the responsibility.
Along with Carolina, my wife, and Natalia, Olivia, Clarissa, and Ivan, greetings from California. Mr. President-elect, Madam Vice President-elect, I am honored and excited to join your team. The mission of the Department of Health and Human Services has never been as vital or as urgent as it is today. The COVID pandemic and its economic fallout have thrust families into crisis. Too many Americans are sick or have lost loved ones. Too many have lost their jobs, and with that, their health care and hope. You have made it clear, Mr. President-elect, that to build back a prosperous America, we need a healthy America. That then will be job one for your team at HHS. 55 years ago, during another time of hardship, former Health Secretary and fellow Californian John Gardner said, "What we have before us are some breathtaking opportunities disguised as insoluble problems." Gardner went on to help President Lyndon Johnson build the Great Society, ushering in Medicare, Medicaid, and civil rights that brought greater equity, greater opportunity, and greater hope to all Americans. Now it's our turn to discover the breathtaking opportunities before us in the midst of this hardship and pain. It's our turn to build up and to back up our doctors and medical professionals, our hospitals and clinics battling the coronavirus. Our turn to restore faith and confidence in our leaders, to deliver solutions that unite and heal us and inoculate us from fear. Our turn to spur our brightest minds to launch the next generation of innovative medicines and cures. And it is our turn to build a nation where, as the President-elect so often says, healthcare is a right, not a privilege. At HHS, tackling pandemics, saving lives, keeping us healthy should be our calling card. And we won't forget that there is a second H in HHS, the human services, the work we do for our children, seniors, and disabled. They will stand tall in a Biden-Harris HHS. Almost a year ago, on New Year's Day, my father Manuel passed away peacefully at home surrounded by his family. We got to celebrate Christmas together. And when the end came, my dad knew we were there with him. No one should ever have to die alone in a hospital bed, loved ones forced to stay away. That seems so contrary to the values of a great nation, the values that drew my parents, like generations before and after them, to come to America. Manuel and Maria Teresa had only their health and hope when they arrived in California, a road construction worker with a 6th grade education, and a clerical worker who arrived in her teens from Guadalajara, Jalisco, Mexico. As they helped build a better California, they built a pretty good partnership that lasted 67 years. And while they never got to experience the inside of a college, they did send their 4 kids there, as well as to the military. Now, President-elect Biden has offered me a breathtaking opportunity to work with his team to shape our healthcare future. I share the President-elect and Vice President-elect's determination to rebuild unity and civility in America. We know it takes hard work. We know we must do it together. We know it will be key to building critical momentum and support for the prevention and treatment of the coronavirus. Those values and priorities will help us emerge from this pandemic a stronger, more just, and more equitable nation. Literally, there are millions of small business owners and tens of millions of workers who are counting on us. I am proud to have this chance to implement the President-elect's vision for a better America through the challenging assignments that are in store for the Department of Health and Human Services. Mr. President-elect, Madam Vice President-elect, thank you for this opportunity to serve.
Mr. President-elect, Madam Vice President-elect, thank you for your trust and your confidence. I bring greetings and thanks also from my grandmother, Sarojini, my mother and father, Maitreyi and Halagiri Murthy, from my sister Rashmi and brother-in-law Amit, and from my dear wife Alice, and my dear children, Tejas and Shanti. We thank you for this opportunity to serve. When I left my role as Surgeon General, I never dreamed I would have the opportunity to serve again. And in this moment of crisis, when so many Americans have fallen sick and lost loved ones, when people have lost their jobs and are struggling for childcare, I feel grateful to be able to do everything I can to end this pandemic. While this is a daunting task, we absolutely have as a country what we need to overcome this virus. We have world-class scientists. We have courageous medical professionals who are risking their lives to care for the ill. We have companies that are on the cusp of delivering vaccines. And most of all, we are blessed with generous and compassionate people all across America who are stepping up to help those who are struggling. If we work together, we will overcome this pandemic and return to our lives. But COVID-19 is not the only health crisis we face. If anything, it has underscored a host of other epidemics that are devastating families and shortening lifespans. Crises like addiction, including the opioid crisis, our aspiring mental health concerns, our glaring racial health disparities, and the high rates of chronic illness that we face, like diabetes and heart disease. These challenges are both caused by, but also exacerbated by, broader societal issues, from the economic strains so many people are facing, to the disconnection and loneliness that many of us feel. In my new expanded role, I will work to bring a health focus to our policies across government so that our schools, our workplaces, and our communities can be forces for strengthening our health and well-being. But the truth is that the very best policies, and even the best vaccines and treatments, will not heal our nation unless we also overcome the fear, anxiety, anger, and distrust that so many Americans are feeling right now. So more than anything, I will come to this role as a doctor, one who learned the most important lessons about medicine not in medical school, but from the clinic that my parents opened when they first came to America as immigrants decades ago. As a child, I saw how they took their time, not just to diagnose illnesses, but to ask their patients' families about their lives, to pore over pictures of children and grandchildren that were pulled from wallets. They listened deeply to people's stories and their struggles, often running well over their appointment time. And they taught me that the best doctor is not an authority figure who writes prescriptions, but rather a partner in healing. Someone who sees patients in their fullest humanity and empowers them to take charge of their health. That is the kind of doctor I have always tried to be. And if confirmed, that is the kind of Surgeon General that I will strive to be. I will dedicate myself to caring for every American, driven always by science and facts, by head and by heart, and endlessly grateful to serve one of the few countries in the world where the grandson of a poor farmer in India could be asked by the president-elect to look out for the health of an entire nation. That is a testament to the promise of America, one that I will seek to fulfill every day as Surgeon General. Thank you so much. And thank you again, Mr. President-elect and Madam Vice President-elect, for this opportunity to serve.